So we'll just go through what the College of Ophthalmologists is basically and what it does for ophthalmology in the UK and overseas, and how that can fit into the Greek system and how that can help Greek ophthalmologists before we move into the roots of becoming an ophthalmologist in the UK on different levels, whether at the level of foundation doctor internship or a level of trainee, a level of clinical fellow, or a level of consultant. So the Royal College of Ophthalmologists basically has a vision since it was chartered in the 80s, and basically to give everyone access to receive high quality eye care for the prevention and treatment of eye disease, to optimize and preserve, restore sight. The role of the college is to deliver the aims of the strategic plan, which is updated 3 to 5 years and with annual audit of the strategy, to strengthen the reputation and leadership credentials of the college as a national voice of ophthalmologists in the UK, and to support overseas countries in developing ophthalmology training and education. No one is saying who's better than who, it's partnership. And we, as an organization, we learn from other organizations and we offer what we have if there are any learning points to share. So we try and influence and engage the health policy decision with politicians, with the Parliament, with the Academy of Medical Royal Colleges, with the General Medical Council, with NHS England, because we are the voice of ophthalmologists in the UK. We try and be inclusive in everything we do and go through the structure of governance to show you how it's very diverse across the board from every ophthalmologist basically in the UK who's welcome to share in the work that we do. So the role of the college is basically to educate, train and assess medical practitioners to become ophthalmologists, maintain proper standards in the profession, promote study and research, further instruct and train both UK and overseas ophthalmologists, and to educate and inform the general public. And we do have publications aimed at the general public, a patient who wants to read about a disease or about the healthcare in ophthalmology in general. The role of the college has been very, very important during the COVID. I'm not sure if there is something similar here in Greece, but during COVID time, like everywhere, we had to stop practice for a few months, and then obviously that has created a lot of backlog and patients waiting for appointments, and the college role was essential in designing the return to normality and how to cope with patients who are waiting in different specialties and with different diseases. The college obviously has an important role in defining what curriculum is there for training. In the UK, we have curriculum nationally. If you have a trainee who qualifies in the south of the country, they will receive the same competency or expect to have the same competency for equal to anyone who qualifies anywhere else in the north, in Scotland, in Wales. It should be unified. Dylan has spoken in detail about the examinations which are run by the college, and it's the only accepted examination for our trainees to become consultants or to obtain the CCT certificate of completion of training and join the specialist register. The college has given advice on various areas of practice, including high volume cataract surgery and cataract training. And we have published in 2021 something like a formula or an equation to help the healthcare plan, whether it's NHS England or the commissioners. So, you know, with the increased longevity, people live for longer. We have more availability of cataract surgeons. People come and request cataract surgery earlier. So we need to have a plan in 5 years, in 10 years. So how much resources you need to cater for this. And it's available online and it can be applied. It doesn't have to be relating to the UK. As long as you know how to use it, you can plan for the cataract care. We developed routes for the MDT teams, and we are providing proper standardized training for ophthalmic clinical practitioners and specialist practitioners and advanced practitioners. When we visited OMMA for the exams, we saw that there are some technicians who are involved in scanning, in vision checks, in taking history, in entering the data on the software for patient management systems. So it's basically something similar, but it's more in a more structured manner, covering the whole UK. We provide additional services for online e-learning platforms, and we network with the communities. And we are very active in guidance and publications. We try and influence policies through various discussions with stakeholders. We keep our members informed of what we do, any changes, any drug-related adverse effects, new publications. So we keep the members and the public up to date, and there are multiple benefits for becoming a member of the college. This is just examples of different avenues of communication that we have in the college. So we're committed to develop and promote the high standards of patient care in ophthalmology. We support our members. We work with organizations of various healthcare sectors, and our charter has set what we should be doing and auditing for ourselves, from the curriculum, from the guidelines, from what skills we need to provide in skill courses that we run in the college, how we promote the research and the innovation, and how we influence policy and advance education in eye health. And the college is governed as a charity, and this obviously has some implication on how the finances flow, because as a charity, you are not an organization of profit making, and we are monitored closely for this. So the history of the college started with the Ophthalmological Society of the United Kingdom, followed by the Faculty of Ophthalmologists. The society was founded in 1880 by Sir William Bowman, and we had annual meetings since then, except a few years during World War II. And then the faculty was formed in 1946 by Sir Duke Elder. And then our royal charter, our current royal charter, was created, the college as it stands now, in 1988. The trustee board is the highest level of governance that we have in the college, and we determine the bylaws, and we obviously hold the president and the CEO accountable for any decisions. So we have to review. We care for the reputation of the college and the profession. And as I mentioned, it's very, very diverse, and from every background. Anyone who is eligible can be invited to be a trustee. And then there is the council, who's more involved in running and managing the senior management team in the college, and made up of college officers, regional representatives, committee chairs, and there are 35 members of the college council. And obviously there are regular meetings with reporting from the senior management team and then back to the senior management team. So the college provides comprehensive program for education and training, resources and guides. And then I'm going to move to the part where we talk about how you can have a route to become an ophthalmologist in the UK if you're not UK ophthalmologist. So as we mentioned, that the process of working in the UK for non-UK qualifications has changed since the Brexit, and it went through different phases. It hasn't reached where we are now at the moment, just straight away. And exactly as you've mentioned, RC off not only to qualify to become on the specialist register, because there are other routes to go on the specialist register, but as market and as an employer from the NHS, you look at the CV and you look at how people qualify, and obviously FRC off adds a lot to the equation, because you know what you're getting, because it's a structured exam mirrored against training system in the UK. So the type of application and evidence needed to register depends on where you got your medical qualification rather than nationality. Before Brexit, if you're from the European Union and you are specialist, then you get automatic admission. You would not have been requested even to provide evidence of English language, but this has changed now. It's not about your nationality, it's about where you got your specialist qualification, and everybody is asked to provide proof of English language unless their primary medical qualification has been obtained in the last 24 months from a country where English is spoken as native language. So as an international doctor, you identify as someone who's not UK resident or does not have UK citizenship. So this includes doctors who have received the primary medical qualification from a UK university and completed their foundation training, but do not have settled status or the right for indefinite residence in the UK. Some international doctors may be entitled to settled status in the UK, so always check, because some circumstances can apply, which can make the route much more straightforward. So any doctor will need to register with the General Medical Council, because this is the license you get to be able to practice in the UK before undertaking any direct patient care. And the purpose of the GMC is basically to hold the medical register, the standards for doctors, to look after education and training in general for any doctor, to have the revalidation system in place, because you cannot just go on the register and stay on the register. You need to have an annual appraisal where all your work, practice, what you've shared in the governance, your professional development is looked at, and it's a two-way process. And 5 cycles of appraisal, which means every 5 years you have to apply to be revalidated in the UK. And obviously it addresses concerns from the patients and the public against any practicing ophthalmologist. So this is the website for anyone who wants to apply for a foundation program in the UK or for a training program in the UK. It's run on Oriel website. And this is the major website for NHS jobs in case you're applying for non-training posts. When I say non-training, it means non-resident. So if you are applying for a fellowship and you consider that part of your training, you can find the jobs on this website. If you're applying for locum consultant post, specialty doctors, locum consultants, consultant posts, all on available on this website. So a question which have been passed to me by one of the young Greek ophthalmologists: why should I pursue residency in the UK? The UK, the dynamics of work in the NHS has changed, especially recently. Obviously, now they are trying, the GMC is trying to qualify ophthalmologists quickly. So the training system was 7 years. So it's just a run-through training. You enter from the first point and then you exit after 7 years. There was a parallel route where if you have more than 18 months of ophthalmology experience, then you can enter on an ST3 level. So you apply differently, not starting from ST1, ST2, you can apply to go on ST3. But this has been scrapped altogether, so it's not available anymore. And the entry point has been extended up to 30 months of previous experience in ophthalmology. You can still apply as an ST1 level. The whole idea is that they wanted everyone to go through the same system and to shorten the period required to qualify a consultant after training in the UK to 5 years. It's still allowed to run up to 7, but if you get all your competences in place, then you can qualify after 5 years of training, and obviously that includes passing your exams. So it's a highly competitive route to apply for, and I will just come to the numbers in a minute. So the RC of our college has run a census around the workforce in the UK, and the numbers were shocking. So in 2022, we found that 76% of the units do not have enough consultants to meet the current patient demand. So the UK now is very, very welcoming of overseas doctors to come and register, and jobs are available. Actually, jobs do not get filled at the moment. To keep up with patient demand, the NHS units are increasingly relying on locum consultant, where you can get a locum consultant post without being in the specialist register while you finish your paperwork in case you want to have a substantive post. And the percentage of that has increased as well, while 65% of the trust use locums to fill the consultant vacancies. The staff shortage hitting patient backlogs across the UK, and in January 2023 there was over 632,000 patients in ophthalmology waiting on ophthalmology waiting list in England only. We're not talking about Wales, not Ireland, not Scotland. Only in England there was massive wait, and 24,000 of these patients were waiting for more than a year. And the workforce shortage in the NHS eye care service set to worsen. So the consensus has said that it's not actually going to get any better. It's only getting worse because we don't still seeing any signs of improvement. So what I'm trying to say, there is a lot of pressure on the National Health Service system in the UK, which is main provider of the care, including ophthalmology. And that basically means that there is big opportunities for anyone who's aspiring to move to the UK and work there. There are jobs available. What is the benefit of working as an ophthalmologist for the NHS in the UK? So it's a world-renowned training system, whether you enter the training program on a run-through or whether you train out of program. It has flexible and part-time working possibility. There is a high income early in your career because trainees earn well in the beginning, keeping in mind that they are learning as well. So you get paid while you get trained. And after qualifying, of becoming a consultant, you can work anywhere in the world. You have excellent pension scheme and benefits and reasonable holiday entitlement. So how competitive is UK residency in the UK? In 2022, the ratio was 9-1. Every place, 9 people were competing against. And the last round of ST3, where you could enter in the middle of the training system, it was 4-1. But as I said, this has been scrapped altogether. This option is not available anymore. So how does Brexit affect the international doctors applying for residency in the UK? If you want to become a resident, you know the history that the UK left the EU on the 31st of January 2020 and entered the period of transition, which was very, very painful. And I don't think the repercussions has been dealt with yet. The UK government introduced new immigration system in January 2021. And to exercise your right to live in the UK, you must be able to support yourself and your family without recourse to public funds, even if you're European. And if you arrive in the UK, starting from 31st of January 2021, you will need to get a visa in advance, or what we call a work permit, if you plan to go there, settle and work. So now this transition period has ended. The registration process for some doctors with non-UK qualifications has changed. And this is when I would like to hear some of your experiences, because you've entered the system in various points and with various routes. So before the Brexit, as we mentioned, if you qualify in Europe, you can have direct entry, just send certificate, just simple paperwork, you get direct entry on the specialist register in the UK, and then you can apply for consultant jobs regardless. Now, the point that they have made, okay, now you're not part of Europe, it's not about nationality anymore. If you have your qualification from a European country, regardless where you're from, and the GMC has identified a certain body which provides the certificate of qualification in each country. So if you hold this certificate, you send it to them. Although it's not automatic, they look at it, but they do accept it, provided you give a proof of English language.